Hello. Hello. Good evening, everybody. Um, I'm Laurel, and on my right, or maybe it's on the left, not really sure if you're looking at your screen, on the right is Dr. Nicholas Morris. And we're here this evening to do a Facebook Live on COVID-19 and the coronavirus. First of all, I want to thank Luke, who's actually on the phone with me at the moment, Luke Edge of Advanced Edge IT, who's making sure that technically nothing goes wrong. You'll find him in our business directory if you need help with any of these online technical platforms. So here we are. When I look at pictures of myself last month, I feel like I was a different person living in a different world. Oh, Luke, what was that? Okay, sorry anyone watching, just had a bit of a tech issue there. I look at pictures of myself and I just think, I feel like I look completely different. My whole psyche, brain has changed, and I'm sure many of you feel the same. It's just really challenging times, really difficult in so many ways for so many people, not just financially, but mentally, and the realization every day of just how serious this really is. On a personal note, I have to self-isolate for medical reasons. I do have wonderful support, so nobody worry. I've also got Dr. Nick on call, so I'm okay. But it's, and I'm used to working from home, but just knowing I can't step out my front door, it's a very strange feeling. So, Dr. Nick, I'm going to pass everyone over to you. I just want to say thank you very much for taking the time to talk to everyone. We really appreciate it. And when the questions come, you can let me know, depending on how many, if you want me to help you moderate them or if you just want to answer them yourself. I just want to say to everyone listening that Dr. Nick cannot answer personal questions, but individual cases on coronavirus, obviously. But anything else, he's very happy to answer your questions. So lastly, if you do ask a question, you have to grant StreamYard, the platform we're using, access so that we can see your name. Otherwise, we can't see your name. We won't be able to answer your question. There are instructions in the description. You just click a link. They don't get any information about you. It's just your Facebook name. So over to you, Nick.
Well, Laurel, thank you very much for inviting. I've never done anything like this before. I think the last thing I did in a similar way was many years ago on, I think it was Spectrum Radio, and I did a broadcast, and there was no one listening to the show. So I felt like a very bad Frasier. And then they had to ring in from the office to fill the questions in. So I hope today people will be texting in, and hopefully I'll be able to answer their questions. Just to give a little bit of a brief biography about myself. I've been a doctor for over 35 years, or will be this summer 36 years. And in my life, I've never seen anything like this. And I've spoken to many, many people in my profession. And I think everybody, all of us, whether we're a healthcare worker or whether we're the lady on the till at Sainsbury's local, we're all in the same boat. And the first message I'd like to give to everybody out there is what we need to do currently. Because just before Laurel took us on air, Laurel and I were talking about Great Ormond Street and the news tonight that there are over 68 healthcare workers who were positive for COVID at the hospital. And that's telling us something very, very important. And what that's telling us is, just like in Wuhan, where the infection base was the healthcare professionals, and they caused the infection to spread widely within Wuhan without even knowing it because they weren't infected. We have that model here now. And what the government needs to do, and the government needs to do urgently, is to look after the healthcare workers and look after their families, look after the people at Asda, look after the police force and the street cleaners, anybody who's people fronting. Now, I'm in a privileged position. I'm not a frontline doctor. I'm not an intensivist or an ITU nurse. I'm a gynaecologist. I saw 2 patients today, and I've been a doctor a jolly long time, and I had to put a spacesuit on. So in 3 weeks from when we were last all having a normal life, things have changed. So I'm ready to answer questions, but our job now, all of us in society, is to prevent the terrible surge that's predicted for Easter and just in 2 weeks' time. So we need to work on that now. And we need to help everybody front line by giving them some kind of support, and the government needs to get testing done. End of my sermon.
End of your sermon.
There we are. That's it. Yeah, I thought that would be a useful start.
Well, you do have a question there, so I'm not sure who that is. If the person can type their name, that would be very helpful.
I can't see a question.
So somebody's saying that their mother's been admitted to hospital. She was feeling really unwell and weak, but breathing okay. I would warn you, despite breathing okay, oxygen levels low. I'm grateful that you came and hope we can save my mum. It's very sad. Luke, I'm just going to ask you, is there a way that Nick can see the questions? Can you see the questions now?
Question. I just don't know who the person who asked it. So, right. Well, you know, I think it's oxygen levels at 70 is very, very bad news. Can you just answer one more question? How old is your mother?
Say how old your mother is, please, and also could you write your name? And Luke also has a question with younger people. Can you see Luke's question, Nick?
I can. I think what we've learnt in the last 24 hours, which China had picked up right at the start of the problem, is we talk in medicine about something called the viral load. That's the amount of virus that you're exposed to. And what's become fairly clear to all the virologists in the UK and around the world is that the more virus you're exposed to, there's a greater chance that you will have a worse infection. Because this illness is very, very infective, and it gets everywhere, and it seems to have an extremely long half-life. Well, Lisa, I'm very sorry to read your story, and I hope the hospital was able to help your mother. I'm not a chest physician, so I don't work on the front line in the hospital, but she's 85. Okay, well, I think at 85, the hospital will need to advise you and your mother about how best she can be managed. And that's from hospital to hospital. Every hospital will have a policy. I know at the Whittington, they're working very closely with artificial intelligence about how to help people make the right diagnosis of what to do. So I'm very, very sorry, Lisa. There's not much more I can say, but do fire away with more questions. I can't comment on each hospital's management plan, but obviously there is one in each hospital.
So while there's a pause in questions, talk to us, please, about face masks.
Oh, right. Okay. So I bought these today. These are called N95 face masks. Let's get that back on screen. Okay, there we are. That's an N95 face mask, and you can buy them online. You just have to look around to see where they're available from. They're what the building industry use, and these N95 masks, there we are, they will protect you from infecting members of your family. Because let's say you get symptoms, then you can put this on and you can stop infecting other members of your family. And I think this is really, really important. The beautiful thing about these N95 masks is you can put them in the oven at 70 degrees for half an hour and they're sterile. You can wear them to go out shopping. It protects you from infecting potentially other people and other people from infecting you. And as Laurel and I were talking about earlier, masks have suddenly become much more important. Now, some of us have watched that beautiful video, I think you've seen it, Laurel, from Czechoslovakia, of the importance of masks. You know,
it's great, that video.
It's a super video. And we know from the Chinese and Asian community in England, they've been wearing face masks for a long time. And sort of up until a month ago, all of us were raising our eyebrows at that. But now we know they were doing the right thing because they were preventing themselves getting other people's infections and preventing themselves from infecting other people.
Dr. Nick, I just watched something on that. I saw some pictures of the 1918 Spanish flu pandemic, and they were all wearing masks then.
They didn't have anything else then, did they? I think one of the things that we have now is we have much better medicine. But of course, every time there's a pandemic, there becomes a different type of problem and complication. So we live longer. So by living longer, we're potentially more vulnerable to something like this. And that's the problem. People didn't live the lengths of lives they live now back in 1918.
Yeah.
So Lisa, I'm delighted to hear your mother managed to walk to the ambulance, but the problem is when the SATs are quite low, like your mother's were, you know, that's what they've got to manage. And each hospital will have a different protocol for managing very low oxygen levels. So I hope that your mother, and I'm sure your mother is in good hands, and I wish you all the best in your mother making a recovery. I think the important afterwards is, let's be positive. Let's say your mother makes a recovery. It's how she feels emotionally and physically afterwards. Now, this is not my world. I'm very blessed in my family. We're all doctors. And my elder sister's a geriatrician. And she, at this moment in time, because she's retired, she's in her 70s, she's planning on producing a protocol that we can all help with the people who've been in hospital, who've been ill. So whatever conditions they come out with, they get a degree of support. Because as you know, there is no such thing as support anymore. And this is now acutely needed because there are people coming out of hospital, whether they're your mother's age or whether they're much younger, who have no one to help them. Your mother has you at least, but it's really the aftercare that's going to be very important too.
Well, we don't have any more questions right now, although they are welcome. So what's your next subject about?
I think what we'll talk about is we'll talk about this. The protocol, which I talked to you a little bit about during the week. So, look, I'm a gynaecologist. I'm not an intensivist. I'm not an epidemiologist or an infectious diseases doctor. My frontline work finished about 15 years ago when I ran busy labour wards and looked after very sick people. What concerned myself and my colleague Sanji Silva was the sort of apparent delay in providing testing. So one of the reasons we decided to do this broadcast was because we wanted to have much more formal, vigorous testing. And I think what's really, really important is that if we have formal testing, we can protect people, we can protect the health workers, we can protect the frontline workers. We keep everybody in lockdown with a planned exit so that we know when people are immune, we know when people are infectious. And I think that's terribly important. We've got loads of questions coming in now. So should we look at them? I'll put my glasses on.
David, okay, so I know David Graham, Dr. Nick. Is there likely to be long-term lung damage after getting COVID?
The evidence is if you do get, I've only read what's in the literature. I haven't treated anybody, but there is evidence there is lung damage. For some people, it might be long-term lung damage, which is why I go on to my point. If they do get long-term lung damage, then there needs to be appropriate aftercare to help them. So that's a good question. Thank you for that.
Is that I read, I don't know if this is right, but if you get more than 50% fibrous lung damage, then that's long-term?
I would imagine so. I don't know the answer to that question. I'm not a chest physician. I can ask one of my colleagues, but I think the problem is the virus causes an autoimmune reactions in the lungs. It stimulates a protein called the ACE2 receptor to be upregulated, and that causes the lungs to become very leaky, and they get this condition called adult respiratory distress syndrome, and that has, whatever the cause is, it has a very poor prognosis, and that's the problem. In my career as an obstetrician, I've looked after 2 women who died from chickenpox pneumonia. Now that doesn't make the press, but that's what happened. And the tragedy for those women and their families, we're now seeing in many, many ways. There's a question, is it from David Graham at 6:13? David, would you expect a GP to refuse to go into a care home to provide a certificate of cause of death where the resident was not suspected to have caught COVID-19, but where other residents had it? It does seem a bit strange. Doctors should go into care homes and should provide certificates. I think if that's happened and you know about a case like this, it would be worthwhile discussing it with the commissioning group to find out what their policy is. I imagine every commissioning group will have a different policy.
He's also saying, Nick, that there was full personal protection.
I saw that.
Yeah.
Well, I think that's rather sad if that was the case, because we as doctors have a duty to look after patients, and unfortunately, you know, we know from the last 2 days that 3 doctors have died on the front line. What's strikingly worried about those doctors on the front line is they were all in their late 60s and they were all from ethnic minorities. So it's actually telling the profession, maybe people over 60 should not be front line. And maybe what we should be looking at now is getting all the doctors back who've left medicine and gone to other worlds, and they should work on the front line because they're young and their immune systems will stand up to the stress of what's going on.
Paul, thank you. That was Paul, who is in our directory. So Nick, the one that asked about long-term lung damage, and I'm assuming that's if somebody. I think what you're asking, Paul, is that anyone that's had COVID-19, or is that just people that have been on respirators and ventilators? I
think it's people who've been on ventilators. Anyone who's gone into respiratory failure will have a problem. They'll have less of a problem if they've been treated with CPAP, because it meant the CPAP, which is a device that fits around your face and fills your lungs up with oxygen. CPAP has been shown to be very effective, and there's some hospitals that are using a lot of CPAP. But I'm not an intensivist. I'm not an ITU physician. I just know what my colleagues tell me on the front line, both at the Whittington and St Mary's. What's the next question, Laurel?
Somebody's saying, and I don't know who it is, that they're way too anxious to watch, and that is, I think lots of us feel very anxious, and I think that it comes in waves.
Anxious to watch what?
You talking about this.
Oh, I'm so sorry. I apologise.
But I think, you know, it's very difficult. I think one thing that's really helping me being on my own is, thank God it's all happening in the days of technology like this, where we can still see our loved ones. And the radio is a really good, keeps you company. You hear people, they're all talking about it, and you don't have to listen to it all day. You can listen to Capital Radio if you want, or something else. But just hearing human voices when you're self-isolating. Otherwise, you get excited like I did when the delivery driver came the other day, because I hadn't seen a face for about 3 weeks. The person that's saying they have bronchiectasis, my mother. Okay, so my name's Laurel, not Lauren. It is my pet hate to be called Lauren. So whoever you are, Facebook user, unless that was a typo, and then I'm sorry. My mother actually has bronchiectasis. I do know a bit about it myself, but obviously I'll leave Nick to answer these questions coming in.
I don't know who you are, Facebook user at 617, but I think the thing is, we all know the story, and the story is someone who has these risks needs to be in lockdown isolation for as long as possible. Now, I have a mother-in-law who's accepted, and it's her age, she's as fit as a fiddle, that she's going to be locked down for 3 months at least to survive. And it's not because she's unwell, it's because we don't know if that virus is going to come back. So, you know, you have bronchiectasis and diabetes, you need to take really good care of yourself. But what measures can you do at home to protect yourself? What sort of diabetic are you? Are you a type 2 or type 1? Are you type 2 or type 1?
So that's AIN, it's a typo. Okay. Well, there's actually a question above. So while that's being answered, there's actually a question above. We're shielding due to an 84-year-old and a nephew with lung issues. We know it's 3 months, so is it going to be longer? And what is survival rate currently? 10% death rate from positive tested people.
Well, I think we need to be very clear. We have no idea, because we're not doing any national screening at the moment, what the death rate is. What we do know from what I know from my colleagues in Italy, who I speak to a lot, because obviously we treat very similar patients, and I need to know what's happening to their gynecology and obstetric patients, is that the older you are, the greater the risk. So in Italy, which has an elder population, that's the problem. So if you're old, stay indoors, stay away from people. Don't worry about the dust, just look after yourself. If you're young, you've got less of a risk. Reduce your risks and make sure everybody you know act sensibly and reduces their risk by staying indoors.
Anya, sorry, I've never known how to pronounce your name. I'm really glad you've just told me. So she's saying, Anya, she's type 2 diabetic.
Well, if you're a type 2 diabetic, metformin is really important. Make sure your blood pressure is fine and you do your breathing exercises. Now, hot water drinks. Now, Laurel, is that a hot water drink you've got there?
Well, it's not hot.
But it was hot originally, was it?
No.
Okay, so Laurel from now on is going to drink lots and lots of hot drinks because this virus lives here in the sinuses and here in the sinuses and up here. And this is the coldest part of our body. So the outside of us is the coldest part of our body. It likes a temperature of about 32 to 34 degrees. If you have hot drinks the whole time, all the time, it helps stop the virus taking over your body. So we're all potentially at risk of getting the virus. I might have it in my beard or in my sinuses. What I do every day is, and it disturbs the family, is I do a steam inhalation in the morning with menthol crystals and then have a massive coughing fit. And then in the evening, I do a further steam inhalation. Very attractive side that might be. But I think anybody with your sort of risk, Sonia, should do something like that. Get your chemist to bring you around a little bottle of menthol crystals. They come in something about that size. They're very small, and use them. And just put them in boiling hot water with your oldest towel and keep your head over it for as long as you can. And drink plenty of water. Vitamin C, 1 gram a day is all we can normally absorb, but take more. Some zinc support is very important as well. And eat as many bright vegetables as you can.
So Barbara of Gadabout's Travel is asking you what your opinion is of medical students being called to help on the front line.
Well, I would like to know what Barbara's opinion is of that. So Barbara, could you type your opinion in so I'll give you mine as well at the same time? I think it's really important that the profession comes together. I worry about medical students. I'm not worried about newly qualified doctors because that's what they are. If I had just qualified now as I did 36 years ago, I couldn't wait to get on the front line because that would be my dream. You know, most of my generation of doctors wanted to be doctors because we wanted to be like Hawkeye or Bones. We just wanted to help people. And I don't think medicine's changed. I'm sure the doctors of today want to do that. So the final year medical students, they're already qualified, they need to work and they need to support their colleagues. I really take a bad view to people who do medicine and then walk away. I think that's very bad. And at this moment in time, we need everybody on the front line to support each other.
So we have another question here. Somebody's asking, Facebook user, please tell us your name. Will we all get it even if we're in the house?
Okay, well, the two ways of looking at this, of course, the newspapers are full of doom and gloom. On my computer, for some unknown reason, every day on this screen, it flashes up newspaper articles. And I don't know how to stop it because I don't want to see them anymore. You know, there are people commenting, well, what's going to happen with this? Well, I think what the government wanted to happen with this was for this to turn into some kind of herd immunity, which is what they want. And I think that's what's happened. There's an argument by delaying the lockdown for when they did, that's helped develop herd immunity. And that probably explains what happened at Great Ormond Street. So if 68 nurses at Great Ormond Street and doctors have got it, that means most people have got it. But most people have got it in the way that has been described, in a mild way, and not become ill. So we don't know what triggers, apart from age and stuff like that, and underlying health risk. We don't know what else is the trigger. Especially, you will get isolated stories about young people, and the papers will only report what they regard as newsworthy. And newsworthy is what's shocking. So when I told you about the story about the 2 young girls who died of chickenpox, that's not a news story, is it? It's just not exciting. But this is the numbers and also the question is, how many people who are dying of COVID are dying of something else? And COVID was a catalyst. It speeded up what was happening to them. And that's an issue as well.
It's a really good point because, like, Eddie Large of Little and Large passed away, sadly. And when they first reported it, it said Eddie Large dies of COVID-19. But actually, he was in there for his heart was failing and they were trying to save him. And then he got the virus. So do you know what I mean? It's just not quite the same when they present the news of the reality.
But he was in such a high-risk group. He'd had a heart transplant.
He'd had a heart transplant?
Yeah.
Oh, I didn't know. I didn't actually say a Okay, well.
So he was in a very risky group. Have we got some more questions there?
Well, we've got one here saying, what is a bright vegetable?
Okay, so I have this big thing about vegetables, and I think any vegetable that has big, so broccoli, carrots, pomegranates, chocolate, red wine, they all stimulate what's called the NAD SIRT pathway. So SIRT is a pathway which reduces inflammation. This condition, COVID, is linked to inflammation. So what's terribly important is to reduce your risk of inflammation. So if you look up the SIRT diet, and you can download SIRT diet books and menus, Otto Lengi is very SIRT based. So that's what bright vegetable is.
Okay, we don't have any more questions at the moment.
Well, we've got, will we all get it, even if we're in the house? And I suppose, you know, that's maybe what the government want. They want everybody to get it. What they weren't prepared for was the severe drama of it. Okay, so we've got someone at 627. I take metformin for diabetes and Nalapur for high blood pressure. We'll take on board what you suggest. Yeah, you know, at the moment, the advice with the Nalapur is to stay on that medication. The data is apparently quite soft on the risk with the Nalapur, but just continue taking your metformin and an Nalapur and try the vegetables as well. And
yeah.
So
we don't have any more questions at the moment.
So what should we talk about?
I'll go with the chocolates and red wine. That's Barbara.
Yeah, I think moderation. Now, can I talk about the post?
Yeah. How long will it take to find a treatment or vaccine? He'd be a very rich man if he knew the answer to that.
But I think I can talk about the post. So should we talk about the post, Laurel? Okay. Yeah. So, Laurel, when the post comes through your front door, what do you do?
I have left it on the door, on the floor, under the letterbox where it's come through for 48 hours. Then, then I pick it up, I read it, and then I wash my hands.
Okay, so you know what you could do is if it's in a plastic wrapper, just take that off. Yeah. If it's in a big envelope, like most posts, and you want to read it, put it in the oven for 70 degrees for 30 minutes, and it's sterile. 70
degrees for 30 minutes? Nick, me and machines, I'll probably end up burning the letter in the oven.
I'll tell you what I did to a pair of gloves the other day, but anyway.
But also, somebody said that they were ironing their letters. Now I know why they were ironing them.
Well, you see, many, many years ago, when we fought the Crimea War, there was such a thing called disinfected post. This is really interesting. This was before this virus. And they thought the typhoid that people got in Crimea was transmitted in the post. So they used to put the post above a fire to disinfect it, and then the post could be posted back from Crimea to the soldiers' loved ones in England. Fascinating, because now we just need to put it in the oven for 30 minutes.
30 minutes, okay. Oh, but so would ironing do the same? It would, wouldn't it?
Well, just the problem then is,
I don't know if it.
I just wouldn't. I just think.
No, I think you're right. Yeah. So now we have a few questions here. In the absence of a vaccine, do we wait until everyone gets it?
Well, I think there's two things here. What we want, which hasn't happened yet, is for COVID-19 to turn into COVID-20. And Laurel, what do you think COVID-20 would do to us?
Oh my God.
Nothing. Nothing.
How will it turn from COVID-19 to COVID-20?
It hasn't done that yet. But what we want is it to turn into COVID-20, which would be as harmless as the other coronaviruses were before. So that's what we're hoping for as a world. What we're hoping for is a world that herd immunity will protect everybody in such a way that we won't have to get another massive peak that's hammering, that will be as hammering as this particular one has started to be to the NHS.
So Someone's saying, I have no cough and no temperature, but trouble breathing, slightly breathless and lethargic. Could this possibly have been COVID?
I don't know. You don't have a temperature, you don't have a cough. You know, I can't answer particular personal questions on that, but if you're worried, you should ring. I know 111's useless, but you know, what age group do you fall into? Could you fall into a risk? Have you exposed yourself to any risk? Like, did you go to the Cheltenham Festival? Were you out and about when you shouldn't have been? Do you feel unwell? You know, lethargy and breathless, that's a sign of it, but maybe it's a sign of other illnesses as well. So take your temperature regularly, do what I said before, do the inhalations, and if you're worried, speak to your doctor. That's important.
Somebody very funny, is that Hotmail? That's very funny. Whoever that is, I wish you knew. That's very funny.
It's hotmail dot disinfectedpost.com. Yeah, that's what it is.
But can I just going back to the post? I mean, any parcel deliveries or whatever, when your shopping is delivered, what would you advise? You know, with the packaging and.
So look, as a surgeon, I'm used to wearing gloves the whole time. So one of the things when you wear gloves for a living, if you never touch your face, okay? So one of the things the government was worried about is people who don't wear gloves for a living, like you, touch your face, and that means you're putting stuff on your face. So my advice is, if you're not used to wearing gloves, then don't wear them, because it's not going to make a difference. But wearing a mask would. In terms of your question about deliveries, everything's delivered, so you now lift it out of the bag that it comes in. And when I take it into the kitchen, I spray the outside of the bag with Dettol. And then I take everything out of the bag once I've sprayed the outer bag with Dettol, having cleaned my hands, and then dispose of the bags. What else can one do? That's it.
So Paul Fegan, that was very funny. That was Paul who made the Hotmail joke. Now, this question about could a dog carry COVID and infect us? I did read in the early stages in China, there was a dog that had weak positive for COVID, but there was a professor on LBC the other night, and she said, you don't need to worry, but clean your dog's paws. So it's a bit of a conflicting advice here with dogs.
Well, look, anything, hair in particular, can hold on to the virus. So I'd just be very careful when you take your dog out. Treat your dog like you treat yourself. Your dog lives with you. You don't want to become a vector for infection. So just keep your dog away from other people when you get home.
Put a mask on a dog?
I don't think with a dog it doesn't infect. The dog becomes a vector, so it means it can carry the virus on its paws.
Without it being ill itself?
It's like our shoes. What the hell do we do with our shoes? You know?
You take them in when you get to the front door and you leave them by the front door.
That's why I suppose people had porches originally. It was all part of what happened 100 years ago or so, I suppose. People's shoes all stayed at the front door.
Is that really?
Well, you know, we can wash shoes. You know, trainers can go in the washing machine. I don't know what temperature they need to go up, but obviously quite hot. You know, the hotter it is and longer it is, the better, without actually causing the trainer to fall apart. But that's what you can do. You know, it lives on plastic for a long period of time.
We're wearing gloves and wiping all groceries and putting them away. Is that okay? And washing hands? Well, I think we've just discussed that.
Well, I think everything you do to reduce the virus load in the house, which is what you're doing the right thing. Now, with the gloves, you have to decide how you're going to manage it, because, you know, marigolds and then keeping them is the thing I worry about. Is J cloths. What the hell do you do with a J cloth? Because it's
don't use them.
Yeah, just don't use them. And
you know what? I just made the decision. I mean, I think there's some things you just got to not worry about the cost, but I just got kitchen roll and I'm just using it and disposing of it straight away. I don't want any cloths with any wiping stuff and nothing. I just want stuff that I can immediately use, wipe and throw away. That's mine.
A hairdryer would be quite good, wouldn't it?
Well, there was that whole theory, wasn't there, about...
That was just a joke. But I think hairdryer drying plates and things, if you've got things out, having a hairdryer there saves you having to do that. You know, and of course, the other thing is, what do you do about expensive hand gel? Well, what you can do is you can get some aloe vera and you can buy some alcohol, you know, proper surgical alcohol, and just mix it in such a way that you've got something decent. And that's a hell of a lot.
It has to be 70%, doesn't it?
Well, you want to dilute it because otherwise it burns your skin a bit. If you get pure alcohol 100%, you want to dilute it by at least to 50%, and I think that should be okay. But you know, the expensive Cutan, I bought 3 bottles of Cutan, and my family laughed at it when I came back with them 6 weeks ago. Now Cutan is more expensive than a fine bottle of claret. So for 400 mils, I prefer the claret myself. Have we got any more questions here?
Thank you, Laurel and Nick. Love you guys. Oh, I don't know who that is, but whoever that is, thank you very much.
We love you too.
We do. I love every single one of you. Well, we've had some really good questions. Right, let's hear about your petition. Right.
Someone's going shopping now. So basically, what we started is a campaign which I told you about originally, or about a week or so ago, Laurel. And Laurel will put up the petition afterwards on this site, so you can all have a look at it. But basically, myself and my colleague Sanjeev, who's an ENT surgeon now, you remember the first death in the UK from a doctor was from an ENT surgeon. My wife's a dentist, and the dentists weren't told of the risks. The dentists weren't given any advice until 2 weeks ago. All dental practices should now be shut. They were given no protective clothing. You know, it's appalling what happened in dentistry. But the fact is, Public Health England should have made all ENT surgeons aware of their massive risks. Anyone who's up front, close to a patient, whether an ophthalmologist, a dentist, an ENT surgeon, a hygienist, and an anaesthetist, they need to have absolute care. Now, things could have been done to prevent risks, but they weren't. And it's very, very sad because we had a lead in time and no one thought about the consequences for that. So the petition basically is about protecting the frontline staff. And by protecting the frontline staff and screening them, by having appropriate lockdown with a solution, and that solution is testing, because how will the population tolerate lockdown without an idea of what it will mean? And I think that leads into that next question, advice on how to manage anxiety, fear, and terror. And this was the point that we talked about 15 minutes ago, which is what's going to happen? Because we're not going to go back to the same world before. We're going to worry about other people touching things. You know, I was about 4 weeks ago, I went to have a drink with a friend of mine, and this bloke put his hand out to me and said, "I don't give a monkey's, you're going to shake my hand." And I looked at him and said, "I'm not." And he said, "Why not?" And then he said to me this, and this is someone I don't know, someone I've seen in this wine bar.
Someone you don't know and you don't want to know.
Yeah, but this is what he said, and this was the shocking bit. "Don't you think it was a conspiracy by Murdoch and the Rothschild bank?"
Is he friends with Donald Trump by any chance?
I don't know. But it's terribly, and getting back to your question, how to manage anxiety, fear, and terror. I think if you can stop those awful pop-up headlines appearing on your computer, that's important. But I think what's really, really important, there is a brilliant book which you can probably download onto a Kindle, which is called Full Catastrophe Living. So Full Catastrophe Living was written by the man who developed mindfulness.
Yeah.
Have you got the book?
No, but I'm going to write it down.
I lent it to somebody and they haven't returned it to me. It's the most brilliant book, and you can get it on Amazon, and everybody should read it because it tells you how to cope. You're allowed to have fear. You're allowed to be anxious, and you're allowed to have terror. So the most important thing is not to self-judge. Once you self-judge yourself, you're in a spiral of fear and worry, and it gets worse. The book helps. I think there are lots and lots of apps where you can do meditation, where you can focus. Now, none of us know a way yet, I don't, I'm sure you don't, Laurel, of how to deal. Yeah, John Kabat-Zinn, precisely, 639. That's the book. Now, there's CDs that come with the book. You can't download his meditations onto an app. But he's got such a boring voice, it's very relaxing. He really has got the most boring voice. And you listen to this drawling voice from Massachusetts.
Or maybe it's quite hypnotic.
Well, I've used it and I think it's brilliant, but I recommend everybody should become a big fan of John Kabat-Zinn and make him more popular than Beyonce. Right, what next question have we got? Oh, we got a love sign. That's okay, it's a pleasure meeting you, Paul. So I think, messages for everybody are, we need to make sure the government looks after the frontline staff. They need to be protected. We need to stay indoors. We need to be very hygienic with our approach to this virus. This virus is very clever because it lingers. The temperatures in the UK at the moment allow it to linger. Question back again here. It's called Full Catastrophe Living by John Kabat-Zinn. So that's the book. I'll dig it up on the computer and then I'll send it to Laurel and she can.
It's all right. I'll find it on Amazon. I'll share the link.
But I think frontline staff, we stay indoors. A solution for screening the population with a simple test that works, that's reliable. And then those people who aren't infected and those people who are immune get back to life. And that's how we're going to avoid a catastrophe. And the government will need to spend money on this. And the testing is not expensive. The testing for this sort of screening program nationally is going to cost wholesale, i.e. the kit itself. Everything else will have to be free because we've got the workforce to do it. About £6 billion over 3 months, which is nothing compared to the outlay that the Chancellor's talking about in the trillions of pounds. And then we can have, because it's very important, it's very important people go back to work. It's very important that those people who pay a lot of tax are back working, earning a lot of money to pay a lot of tax, because the country needs you to pay a lot of tax. And those people who don't make much money need to get their businesses up and running again. So I have a sort of rather sort of radical theory is get the healthcare workers safe and working and get society back to life, and then get the people who make the most money for the country back to work to protect all of us. And this time they mustn't forget about the rest of us. And this time they can't be living on Wall Street. They've got to be living with us.
I think, Nick, it's been quite intense. Thank you very much. I think we'll do another one in a couple of weeks when we have a bit more information. Okay. And we know more about when the peak is actually coming, because at the moment it's changing.
It's 2 weeks.
They're saying 2 weeks. They're saying the 17th of April. But I'm sure in the next 2 weeks we're going to have even more information than we have now. So we'll make another date. And I want to thank you, and on behalf of all the members in the group and everyone that's listened or asked questions, I want to say a huge thank you, just to know that we've got you to come to every so often and you'll help us with any questions we have. So,
but what we've learned is we can help each other, and I think the only problem the government's done is they haven't accepted our help, and it's frustrating. Today I was talking to Carol Sikora, the professor of oncology, and we needed to have someone of his status to push it forward, because I'm only a humble gynaecologist, Sanjeev's only a humble ENT surgeon, but the number of very senior members of my profession who've been in touch with me saying this must be published, and we hope it will be. But it's very important that this letter we've written to the Lancet is the petition, and if Laurel puts it up afterwards, if you can sign it and pass it to people, that will help. We've been very, very well supported by Jeremy Hunt, who's been helping us for the last 2 weeks. He's been the most responsive politician, amazingly responsive, and he's been using our document to seek help. It's fabulous the Crick Institute's helping, but I think 2,500 tests a week isn't enough. We need every laboratory in the country. We've got the greatest scientists in the world in the UK. And for once, the population is suddenly going to understand how brilliant they are. And let's let them get testing and look after all of us. But Laurel, everyone who's texted in, thank you all very much for having me on.
It's a pleasure. We'll see you in a couple of weeks.
Okay, and stay at home and keep away from people. I had to go. I had to go today. It was weird.
We'll see you soon, Nick.
Okay. Bye.
Bye-bye. Bye.